Alright, future nerds, let's pick up where we left off. So as you can recall from my last video, celiac disease is an autoimmune disorder of the GI tract. It is characterized by an inability of an individual to break down the protein gluten. Gluten is found in foods such as wheat, barley, and rye. Now, what are some other key points you need to know about the NCLEX? Let's dive into diagnosis. So at the time of diagnosis, the individual who's being tested must be consuming a gluten diet. They cannot be consuming a gluten-free diet. The gold standard testing is a duodenal biopsy. Now remember, the duodenum is the first part of the small intestine, so in order to obtain this biopsy, the provider will need to go in with a camera and a tube in order to review the upper GI tract, and when they reach the duodenum, they'll grab a sample, they'll pull it out, and they'll send it to lab. Now, other forms of testing that are not as accurate is a TTG or genetic testing, which can be through blood or other sources. And what are some complications? So if an individual who has celiac disease is consuming a gluten diet, the villi in their small intestines flatten, which can lead to nutritional deficiencies. Nutritional deficiencies can be from vitamins such as B12, iron, which can lead to iron deficiency anemia, and osteoporosis due to low calcium and vitamin D uptake. Now, if an individual with celiac is eating gluten or they don't know that they have a gluten allergy and they are consuming the protein, this may lead to a chronic state of inflammation. This can manifest in the skin like a dermatitis or also as neurological signs or symptoms. Now let's dive into treatment plan. What are you going to do as a future nurse to help your patient? The first thing you're going to do is you're going to educate them on a gluten-free diet. And the NCLEX wants you to know what a gluten-free diet is. So you need to make sure that you're aware of which foods contain gluten and which don't. NCLEX may even ask you if this individual should consult a dietitian, and the answer is yes. Individuals with celiac disease will need routine follow-up in order to continue monitoring them, and they may also benefit from a psychosocial support. I hope you learned something today from this post, and please follow for more. I will be posting an NCLEX style question on celiac disease.